right. Well, welcome.
Thank you.
Well, I'm so glad you were willing to do the interview. Get our team members and our residents and our family members to know more about you. So I'm here with Atiya. If you want to introduce yourself to the audience, that'd be great.
Thank you. Hi, I'm Atiya. I go by Tia. I have been in Maryland for about 20 years. I'm from Philadelphia. We actually moved here because my husband got a job in Montgomery County.
Okay.
And we originally moved to Frederick, but it was hard living in Frederick moving from the city.
Okay, that's a big adjustment.
It was terrible. So some of his friends said that they lived in like Baltimore County, so we moved down and we lived in the like Randallstown, Owings Mills area.
Okay. Do you like it there?
I do.
Okay.
I do. We've been like deciding if we wanted to move to like other areas just because we wanted, we live in a townhouse now. We'd like to live in like a single family home. So.
Okay. Did you like living in Philly?
We liked it. It's much different now, kind of like living in Baltimore City. So
Okay.
it isn't what it used to be.
Okay.
So.
How long were you in Philly, did you say?
20. Well, I grew up in Philadelphia and then my parents moved to the suburbs in Willingboro. So I kind of grew up in the suburbs.
All right.
Yeah.
Well, good. So then you went to high school in Philly then?
No, I went to high school in Willingboro, New Jersey.
Okay.
Yeah.
And then where'd you go to college?
So I went to Community College of Philadelphia for like my lower credits,
Okay.
and then I actually got my RN at Community College of Baltimore County.
Okay, so you got your RN here then?
I did.
Okay, good.
I actually was an LPN for 24 years, and then just got my RN about 3 years ago.
Okay.
Yeah.
And so where all have you worked in your career as a nurse?
I have done everything. I have been a prison nurse. That's actually how I met my husband because he's a correction officer.
Oh, there's the connection. I was thinking about that. Okay.
Yes. I've done long-term care. I've done both staff nurse and unit management. I've done assisted living. I was the director of nursing and assisted living. And I've even worked in retirement communities like this, doing pretty much the same job that I do here. And I did hospice nursing, which was probably one of my biggest loves for almost 10 years.
Okay. Yeah, so you've done the full spectrum. That was going to be my next question is what has been your most challenging and your most, I guess, we don't have a favorite, but your most opportunity that you enjoyed most about nursing so far?
I think I loved them all because they all allowed me to do something different and to use a different skill. Learn management skills in a lot of them, as well as to use a lot of assessment skills, like especially the jail. I used a lot of my assessment skills. And hospice, a lot of the assessment skill learns a lot of medications, plus tie that into training and teaching families and calling families and being able to tie that into empathy and things like that. But always it brings me back to working with seniors. So
yeah. Oh, that's good. And then with all the positions too, it's like you're not only working with your resident and your patient, but also being there for your family members.
Absolutely.
Oh, that's so good. Well, what brought you to Miller's Grant then?
So what actually brought me here was I had worked a similar position, and then when I saw that it was basically the exact same. It was doing the care coordination for the independent living residents as well as team health. I knew I was up for the challenge because I like having one, the autonomy, and two, being able to multitask and doing two positions. So.
Yeah. Well, and especially your day's probably never the same then, huh?
Exactly.
Keeps it interesting. So you joined back in, March of 2022. So you've only been here a few months now. What has been your favorite part about joining the Miller's Grant family?
My favorite part, the residents, definitely.
Yeah.
And getting to know them and them getting to know me. Being able to call, a lot of them are very receptive to when I call and offer a lot of the nursing skills. I think they appreciate someone calling to give them some advice for things.
Absolutely.
So I love that part of it.
Oh, that's such a good to hear. And I feel like you've been here for way longer than 3 months because you fit right in. So we're very happy to have you and that you chose us. So you've been here a little over 3 months and you've added a lot. I know you've tried blood pressure clinics and you've reworked the employee health program. What has been your biggest, or what biggest opportunity or change do you see coming in your department, or any ideas that you may have to pilot with the residents or the community here?
So I think the biggest things I'm working on now is I've looked at a lot of the forms and trying to restructure some of the forms just so that things flow better between us and different departments, and trying to probably rework some things within the medical suite and just making sure things flow there for the providers and myself. So.
Yeah, because I know you work closely with Dr. Abbas with
Yes.
Gilchrist Greater Living, podiatry.
Yes. Dermatology, audiology,
Okay.
and counterpoint as well.
Good. And then I know we're looking at adding another physician. Do you see that being advantageous to the residents as far as?
I do. I think it's going to be great. I think it will. Just and trying to figure out the flow with them, but I think it will be great to offer the opportunity for the residents.
Absolutely, bringing that primary care right.
Yes.
Yeah. Good. All right. So when you're not here, what do you like to do for enjoyment?
I like reading. I'm a big fan of TikTok. I think I told you that before.
That's awesome.
Watching other people, not
Yes.
doing it myself.
We share that in common for sure.
I love going to different festivals outside.
Okay. What kind of festivals?
Anything that brings me outside.
Okay.
So we do different food truck festivals
that.
and wine festivals and anything that's like along the water, like in Patterson Park area, and anything that comes up we like going to. Spending time with my family, and I think me and my husband are just together all the time.
So you're not working, you're with your husband.
Always.
So you say food trucks. What has been your favorite, I guess, either food truck or your favorite type of food that you've stumbled upon?
We usually do I think it's the Taste of Baltimore. And it's all different kinds.
Okay.
But they do have some trucks from Philadelphia, because it's the Taste of Three Cities. That's what it's called.
Okay.
And there's Philadelphia food trucks there. We like it because there's like a pretzel food truck and a water ice food truck there. So we love going to that one.
Oh, good. And what's your favorite type of wine?
Let me see. I sweet red.
Okay, you're a sweet red.
I used to be Moscato, but I've kind of grown
Well, summer
up.
months are kind of nice even for sweet reds.
Yes.
Yeah.
Yes.
Well, good. So one thing I forgot to ask you is what brought you into the clinical side of things? Did you have family members who were in the nursing side, or like what made you call to be motivated to do nursing?
I wanted to be a nurse since I was a kid, but I actually thought I was going to be a pediatric nurse. And then I did my clinical rotation in Philadelphia at the Children's Hospital of Philadelphia, and decided it wasn't for me. No, I like the kids, but it's that parents are hard to deal with children.
Especially sick children.
Yeah, so I was like, yeah, I don't think this is the way I'm going to go. And then when I got out of nursing school in '94, a lot of in LPNs you do a lot of nursing homes, and that's kind of where it grew to seniors. Still with seniors was I enjoyed that.
With having the LPN.
Yeah.
What else do you want to study now that you're an RN? I know you voiced to me some interest in some programs. Where are you interested in studying more?
So it's funny. I'm definitely going back for my bachelor's within the next year.
That's great.
I initially thought I wanted to do my master's in informatics. I may get like a certificate in informatics just because I love computers. But I think I'm changing my mind and getting my master's in informatics. I'm thinking about either doing administration or education.
That's great. Would you keep it that nursing education piece?
Nursing education, yeah.
You like to teach?
I'm thinking about doing like online. Like doing
like a program.
Yeah.
Okay. What would you like to teach online, do you think?
Fundamentals.
Okay.
Because again, that's long-term care.
Yeah. And teaching the basics of that bedside.
Exactly.
Okay. Well, good. Well, we definitely excited for that journey. I know we talked about even you enjoyed the order. Have you thought about looking at your case manager delegating nurse or any infection preventions? Do you enjoy things like that?
Yes, absolutely.
Okay.
Yeah.
Well, good. Well, we are thrilled to have you at Miller's Grant, and we're happy that we had this opportunity so we can have residents get to know more about you and family members. But if a resident or a family member or team member needs you, what's the best way for them to get in touch with you?
So they can call me down in the medical suite. Let me see if I can remember my number. It's 410-696-6818. Or they can email me at apate, millersgrant.org.
Oh, good, and they'll probably get to meet you because you and Michaela, our social worker, thinking you'll be offering some educational series. Do you want to talk just a little bit about what they have to expect in those educational series, what you'll cover in those topics?
Sure. So we have been, some of our home care agencies who've been coming into our facilities and hoping to have some outreach with our residents have been offering different topics.
Yeah.
Like falls and dealing with caregiving for dementia. So we're going to kind of go through these topics and decide what will be beneficial and what we think have a lot of residents have reached out to us with help with, and we're going to offer those topics to the residents.
Good, yeah, and then they'll also learn about you and your counterpart Michaela. Absolutely. And the services that they provide.
Absolutely, yes, and what we offer to them.
Good. Well, good. I'm sure families and residents look forward to getting to know you more, but thank you for being our first interview at Miller's Grant for some time.
Thank you.
All right, thanks.
Thanks.